So let's start the today's session. So guys, who I am, my name is Dr. Aisha Asgar. I am one of the GMC registered doctor. So I'm coming from the platform of Met Instutors as a mentor or tutor, you can say, for the guidance of PLAB 1 and today's session. And I'm running the group from where you have joined the link. So that is my introduction. I'm Dr. Aisha. I am welcoming all of you here today for this session. So we are going to have a detailed discussion regarding PLAB 1 exam guideline, right? Okay, so this is our first slide, which says the objectives for the today's session. So what are our objectives for the today's session? So number one, we are going to have the understanding of the pathway, that what is PLAB 1, how you can take PLAB 1, how you are going to book the PLAB 1, what kind of study material there should be in the PLAB 1. So all of these things we are going to discuss in today's session. Then we will discuss about the eligibility to book the PLAB 1 exam. All right. Then we will discuss the exam content and strategies. Okay. Then we will discuss few a review of a sample questions. We will discuss about the PLAB 1 results and what are the common challenges. This is all what we are going to cover in today's session of this PLAB 1. So, this is the target audience slide. So what does this mean? It means the students who are aiming to pursue their career in UK as a doctor are supposed to join this session. And who are these students? These students could be in final year of their medical school or beyond, right? So I'm sure many of you must be in the criteria of beyond. For example, if a student who already has done his or her MBBS from a medical school and the student is doing his house job, right? The person is eligible for this PLAB route. So we are going to have this discussion, for example, the discussion tailored to those considering PLAB 1 and afterwards. So we are going to discuss this, and no matter what, on whether whichever stage you are, you can give PLAB 1 at any time. But the primarily, the candidates are those who are in the last year of their medical school or who have done their medical school. Okay. So there is one interesting thing about this exam is that this exam is very, very easy to pass, guys. I have given this exam, I can tell you this exam is very easy to pass. But you need to have certain, strategies, certain, schedule which you are going to follow. And by this way, you are going to crack this exam. I'm really sure, every one of you, you just need to prepare for this exam. Simple. This exam is very simple. Please don't confuse yourself that this exam is not easy. It is difficult. How about the difficulty level? So I'm telling you very clearly, this exam is very easy to pass. If you are a graduate, you are definitely going to pass this exam. And if you are guys are with me on this slide, please comment yes on the chat box. I want to see your response whether this exam is easy or not. Please type. Great. This exam is easy. This is the best thing about this exam, Very well done. Great, guys. I'm getting your response. Okay. Okay, so this is one of the slides which says that what is the pathway. So there will be more discussion on test, job, training, finances, and ease. So basically, this is a compiled slide for many candidates, because there are many people who are doing preparation for the PLAB 1 exam. and all of the candidates are not same because some of the students are internees, some of them are in their joining trainings, some are teaching, and some are doing different jobs. So we are going to give a customized, or you can say a generalized, study schedule or scheme for everyone, that it will be covering all of you. Okay. So now what is PLAB exam? As we already know what is PLAB exam, so I want you guys to type in the chat box that what is PLAB exam. I want to know. Okay, great. Arham said that it is licensing exam for the practice. So yes, PLAB is stands for Professional and Linguistic Assessments Board. All right. This is an international exam. It is conducted by the GMC. What the GMC is? GMC is the General Medical Council of the England, which grant license to the doctors from all over the world to practice medicine in England. Okay. So this is what PLAB exam is. So how many parts the PLAB exam has? It has two parts, PLAB 1 and PLAB 2. All right. So what you need to do before PLAB 1? So this slide shows what you need to do before PLAB 1. If you can see the arrow here, it says OET. What the OET is? So the OET is Occupational English Test. It is a language exam where they are going to test your English skills, your communication skills. Why this exam is important? Because you are going to work in England, right? So you have to deal with the patients. So for that, they want to hire someone who is good with their communication skills, right? So that's why this exam is important, what the OET is. So before PLAB 1, you need to give the OET. In OET, you need to have the grade B in all the subtests. It has four subtests. One is reading, one is listening, one is writing, one is speaking. You have to get the grade B in all four subtests. Then you will able to book the PLAB 1 exam. If your PLAB 1 exam is passed, you will be giving the PLAB 2 exam, which is OSCE based exam. And if you pass OET, PLAB 1, PLAB 2, all of these tests you are going to pass, you will eventually get the GMC registration. So what the GMC registration is, this is your license to practice medicine in England. Are you guys clear up till now? Yes, definitely. Someone asked me, can we do IELTS? You can do IELTS, definitely, yes. You have to get the 7.5 bands in IELTS, and in OET, you have to get grade B in all four subtests. So there is difference. Both are applicable, both are acceptable for PLAB 1. So what is OET validity is over before PLAB 2. So usually what the GMC says, it gives you a time period of 2 years from this word to this word. I mean from OET to PLAB 2. You have to cover everything in 2 years. Otherwise, OET is going to expire after 2 years and you have to reappear an OET. So you have to do everything in 2 years. The OET, PLAB 1, PLAB 2. By this way, you will get the GMC registration. I hope you guys are clear up till now. And if you guys are clear, you can type in the chat box clear so that we can move to the next slide. Okay, great. All right. Okay. So this slide says about the eligibility for PLAB 1. So you must have a medical degree, obviously. You must have MBBS degree from a medical school, and then you are going to give the PLAB 1 after passing the OET. Okay. So in this slide, we are going to discuss about the exam structure of the PLAB 1. So what is PLAB 1? How many MCQs will be there? How much time do you need? And everything. This is a detailed slide, guys. So if you guys are with me, you can type yes in the chat box so that I can read this slide, because this slide is slightly important and you can see the core of the whole presentation. So this will give you so many answers to so many questions. Okay, great. Thank you. So now what is PLAB 1, or how does the PLAB 1 look like? So it is an MCQ based exam. You will get 180 MCQs in the paper, and your paper will be, you have to fill the answer sheet. I'm going to show you the answer sheet in coming slide. So it is not a computer based exam. You have to do it on a paper. So it's a paper based exam. You have to clear this, and you will be getting a booklet of 180 MCQs. There will be 180 MCQs in that booklet, and you have to answer on a separate sheet. All right. Number two, what about the time limit? So you will be getting 3 hours for this exam. You have to fill 180 MCQs in 3 hours. Okay. So what will there be in the exam? So this exam is clinical. So you are going to get the clinical questions in your exam. All right. So I'm going to share a list of the subjects in coming slide. So you will get to know. And what you will have to do in the exam, you will have to answer with a single best answer. There will be 4 multiple answers for one statement, and you have to pick the one best answer. So what about the passing score? Passing score is 60 to 65%. Good thing is there is no negative marking. Now, how many times the exam held in a year? So it usually happens around February, May, August, and November. So these are the 4 slots when a candidate are going to give their PLAB 1 exams: February, May, August, November. So exam centers are in more than 180 countries. All right. And the results are in 4 weeks, and the maximum number of attempts are 4. Okay, someone asked me home country license or must are needed. So basically, you should be a doctor before this exam. So yes, it is important. So regarding this slide, if anyone has any question, you can type regarding the exam structure. No, the changing answer is yes, possible, because you are going to fill the answers with a lead pencil, and there will be a eraser. And if you consider this answer was not good, you are going to change the answer. Yes, you can. I'm going to show you the sheet where you will be filling your bubbles. So you will be more clear just in a while. Wait. Any more question regarding this slide? You guys are, you can post in the chat box. Okay, if you guys are clear, then you can type yes so that I can move to the next slide. Okay, all right. Okay, so this one is important slide as well. So there are so many candidates who have doubts that how they are going to book the exam, where they can book the exam, what will happen when they were going to book the exam. So this slide will answers to all of those queries, right? So you know what happened? First of all, you need to give your OET or IELTS depending on your personal choice. For example, any of the uh, English test you want to give, right? You have to pass the OET or IELTS. Suppose there is a candidate who has given his OET and got the grade B. It is clear now. Then what you need to do? Then the next step is create your GMC account, right? So then you have to go to your GMC website. You are going to make a GMC account with your credentials. You are going to set up account with your name, your country of origin, your basic details, your qualification, your degree, your medical school. You have to put all the details in your GMC account. So this is a separate process. After that, what you are going to do, you are going to upload your OET or IELTS result in that GMC account. All right. The GMC account will be created automatically. So after that, what you are going to do, can you hear me? Okay, great. So you are going to create your GMC account. You are going to put your results over there of your English exam. GMC is going to approve the results, and after the approval, you will see the centers all over the world for PLAB 1. You are going to book the exam at your preferred country or your preferred location. By this way, you are going to book the exam. So, any question regarding booking? Okay, okay, fine. So, now about PLAB 1. So, just suppose that we have booked our exam, right? So, what is PLAB 1 again? It is licensing exam for UK. Written part, also known as PLAB 1. It is paper-based exam. We already discussed this in the previous slides as well. So We already discussed this as well. You will get MCQs. How many MCQs? If anyone can type in the chat box, if you remember the information. Good. There is no difference between UKMLA and PLAB. UKMLA is also similar as PLAB 1. There is no difference. Each and everything is same. Course material is same. Number of MCQs is same. Pattern is same. There is no difference. And UKMLA was first taken on in 2024. So everything is same. Just don't worry about UKMLA. Yes, great guys. It's 180 MCQs. So 3 hours duration during the exam. It is paper-based exam, and we already discussed this happens 4 times in a year. Okay, if you have any question, you can post in the chat box. Okay, what you are going to ask about OET, please clear your question. All right, so OET is occupational English test. As I already told you, it has 4 parts: reading, writing, speaking, and listening. So there are further sub parts of reading and listening as part A, B, and C. You have to practice few of the course material before the OET. We can discuss this in our group as well, and we can discuss it later on if you want. So, what's the timeline to prepare? Okay, so someone asked me what is the maximum time gap allowed between PLAB 1 and PLAB 2. So it depends upon the availability of seat. There is no such thing gap is to be allowed. But as a general candidate from different countries get seats on different time intervals, so it totally depends on everyone's personal circumstances, right? So what's the timeline to prepare PLAB 1? So usually it takes 3 to 6 months. This is the timeline for the preparation of the PLAB 1 exam. You have to solve all the question banks with explanations. What are the question banks? Question banks are the study tools from where you are going to do your preparation for PLAB 1. Okay. Any question regarding PLAB 1? Okay, so we are going to discuss regarding the study tools or materials. So we are going to answer you. Any more question up till now? All right. Okay. So we are in February 2025. Yes. Time frame for the preparation is 3 to 6 months, and it totally depends upon your personal circumstances, whether you are at home studying for PLAB 1 exam, whether you are doing job for PLAB with PLAB 1 exam preparation. So it totally depends. But usually 3 to 6 months are enough. And for example, if you are going to appear in the May session for PLAB 1, so from February till May, this time is really great, and you are obviously going to pass the exam. As we already mentioned, the PLAB 1 exam is not too difficult, but it needs preparation. Yes, it needs focused preparation. So what you are going to do for the my exam, you are going to have a question bank, which you are going to do twice. Then you are going to do revisions. Then you will find out the key points for each unit, and then you are going to get your concepts. So you are going to prepare PLAB 1 on this strategy, right? So as we already discussed about the time management, um, as I already mentioned that there will be 180 MCQs followed by 4 answers. So you have to answer one question in 1 minute. So consider you are going to answer one question in 1 minute. So this is the exam day. Yes, source of study. So I'm going to discuss source of study after 2, 3 slides. We will discuss that. Don't worry. Just stay in. Okay. So this slide is really important. If you guys want to take picture from your mobile, or if you want to, you know, take a snap from this slide, you can take. This slide is important. Why? Because this slide says about the number of subjects that are coming in PLAB 1. So you are going to get questions from cardiology, from infectious diseases, from emergency medicine, pediatrics, endocrinology, nephrology, obs and gynae, contraception, ENT, ophthalmology, genetics, gastroenterology, geriatric medicine, pharmacology, hematology, epidemiology, oncology, dermatology, psychiatry, urology, anesthesiology, rheumatology, respiratory system, ethics. They are important in PLAB 1, trauma and orthopedics, neurology, general surgery, anatomy, genitourinary, metabolic medicines, radiology, critical care, palliative care, and maxillofacial surgery. So you are going to be getting questions from all of these units. There is no specific discrimination regarding the number of specific MCQs coming from a specific unit. There is no such description. You have to do each and every unit in a great way that you are going to pass your paper. So this slide should be really clear. Okay, so basically what's in the bracket? These are the roughly number of MCQs that contain in any of the question bank. So this is a rough estimation of the practice question banks, that you can get 305 MCQs in a particular question bank, a 151 from particular question bank. You know, this is just a random estimation of the MCQs that you are going to read. Any more question regarding the subjects to cover? Okay, this one is the interesting slide. So what does this mean? So exam testing, what is exam testing? Now, on which criteria the GMC is going to judge you. So they are going to test your knowledge on the basis of the diagnosis, investigations, management, and treatment. So GMC is going to test you on these four domains: diagnosis, investigation, management, and treatment. So this slide means that you have to do preparation according to this domain. You must know the diagnosis well, you must know the investigations well, you must know the management well, and you must know the treatment or whatever referral or anything, regarding that particular disease or particular condition. It should be really clear in your concept that you are going to answer all of these four domains. So now the study resources, as you guys have asked in the chat box that what are the study resources. So let me explain one by one. So commercially, there are many resources available, but there are few that I have listed are here. One is PLABable. This is a question bank. All right. Second question bank is Medrian question bank. And the third question bank is Med Instutors question bank with study group and recalls. So these are the three resources you can use to prepare for the PLAB one. And additionally, there are PLAB keys. So I'm going to show you the PLAB keys. How does the PLAB keys look like and how you can use them. So as for now, these are the names of the question banks, right? PLABable question bank, Medrian question bank, and Med Institutors question bank. Gems, gems are the PDF file which contains few of the key points. Yes, you can use them for your revision tool as well. But with this Med Institutors question bank, you are going to get the gems and you are going to get everything. Someone asked me where can we get video lectures. So I'm not sure what kind of video lectures you are asking for. Can you explain your question more to me, please, so that I can understand? You don't need to have those video explaining particular topics. Um, we are going to show you how you are going to prepare for the PLAB one. Just wait. We're going to answer this. Okay, so what you need to do in your study plan. For example, you have the time period of 3 months. In those 3 months, you have to study 4 hours a day. For example, if you are doing a job, and if you want to study more, yes, you can. If you are not doing any job or you are free or you're completely giving time to your exam, you can study more. What you need to do, first of all, you need to have a focus study. It's not like that. First, one day you are studying cardiology, second day you are studying gastroenterology, third day you are studying psychiatry, fourth day you are studying random, metabolic medicine. It's not like that. You have to study in a very focused manner. In a very focused manner, I mean you have to divide the number of days or number of units. You have to take one unit, you have to complete that one unit very nicely, so that by the end of that completion you are very good in the concepts of that particular unit. So let me give you an example. First of all, focus study unit wise. For example, suppose we say here that the unit is cardiology, right? What you need to do, you take one unit, for example cardiology. You are going to read the notes before the practice questions. You are going to read the notes before the practice questions, then you are going to practice the similar unit from the question bank, and at the end of the question, every question you will find the explanation. You need to read all of those explanations beneath those questions, and you have to take notes out of those question banks. Then you are going to compile them in a place. By this way, you will apply this to every unit. First of all, you will select the unit. Secondly, you will read the notes before the unit. Then you will practice similar units from the question bank. Then you will read the explanations of that particular unit. Then you are going to take the notes. Okay, so as you mentioned, in India, you have this videos. Yes, you can use them, but they are not too necessary for the understanding. If you are going to study the question banks or you are going to read the question banks, you are good to go. And that is totally optional. If you want to take that, you can. There's no compulsion. Okay. So there is tip. Read the MCQs carefully and try to understand. All right, this is the very important tip. And if you're not clear anywhere in your study, stop there, research, send your query group, ask to your friends, search on any authentic study material, just read very carefully. Don't consume wrong concepts. Then time management regarding every unit is important. And there are few pictures in the question banks. Even you can Google pictures regarding any skin conditions or any disease. It will also help. And then you have to mark your answers carefully when you are going to solve the exam. Yes, it is very possible that you can pass your exam in 3 months. It totally depends that in those 4 to 5 hours what you are exactly doing. The quality of your study truly matters. If you are studying very effectively, then definitely you are going to pass the exam. Any question? Okay. So there is one tip. For example, do not try any new thing near exam. For example, if you are having your exam in 5 days and you are going to study a new thing which you haven't done before, please don't do that. It will just, make you panic and it will just create unnecessary stress for you. And this exam will be, you are going to fill this exam with the lead pencil, so you can have a extra lead pencil with a sharp tip on your exam day. And you have to attempt all questions in first go. You don't need to leave questions for later, because in exam, as I already mentioned, that you will only get 1 minute per question. So what you need to do, you are going to read the question, filter out the answer, pick the right answer, mark it, fill the bubble, move on. This is the exam day. So you have to attempt all questions in first go. So if you are in fourth year right now, what you need to do, you need to focus on your clinical subjects, IENT. And in final year, you are going to focus on your clinical subject like obs, gynae, cardiology, surgery, pediatrics, everything. So you are going to build the best knowledge for your PLAB exam. So right now you need to focus there. Yes, I'm going to discuss the pass mark in a while. Just wait. The slide is coming. So if you have any question up till now regarding PLAB 1, you can type in the chat box. I can answer. And if you guys are clear up till now, you can post clear so that I can show you the next slide. Someone asked me how in depth are the questions. So as I already mentioned, they are going to test you on the basis of diagnosis. on the basis of investigations, on the basis of management and treatment. So these are the four domains. You can say the depth is only these four domains. So this is one of the clinchers, from rheumatology. So I'm going to tell you how this can come in exam as well, right? So there could be any scenario which will say a young man is presented to the hospital emergency with a hot, painful, swollen joint, presented with fever. You are going to make a diagnosis of septic arthritis, and what will be your treatment? So the treatment will be fluoxetine. So now I'm going to break this scenario in three parts. So first part is the clinical sign. Hot, painful, swollen joint and fever is the clinical feature of this particular disease, which is known as septic arthritis. So in septic arthritis, if any of the patient is going to present with you to the hospital, that particular patient will be having hot, painful, swollen joint and fever. Then you are going to pick up your diagnosis that, oh, this is septic arthritis, right? Next is investigations. So what will be the investigation? In this case, it will be aspiration. And what will be the treatment? You are going to give the antibiotic, that is fluoxetine. This is just an example that how you are going to study for the particular disease or particular topic or particular scenario. This is just an example. You need to answer your questions according to the NICE guidelines. You need to answer your questions according to the UK guideline. Remember this thing. This statement will be clearly written outside your booklet that you have to answer according to the UK country, not according to your home country or your home practice. So you are going to read the NICE guidelines for this as well. Any question up till now? Okay. So there is one more clincher from rheumatology which says there is a young man with lower back pain. If a man presented to you with lower back pain and the age of that man is particularly young, in early 20s or early 30s, so it would be ankylosing spondylitis. And what you are going to do, investigation will be the x-ray of the sacroiliac joint, right? And sometime it can come in scenario with any kind of association. So there could be an eye manifestation which is uveitis. So it can also come up like this. Again, this is just an example, just to make you guys understand. So this is one thing I want you guys to understand, that in UK there is a lot of focus on the drug interactions. For example, if you are giving one particular drug to the patient, what kind of effects it can produce with any other class of drug, right? So for example, as we all know that thiazide diuretics, these are given in the patient with hypertension. This is the cardiology medication. These can also increase the uric acid level, and it can also precipitate the gout. So this is just an example of a clincher that it can come in association with one drug giving one benefit, and at the same time it is giving one another side effect. So you have to focus in this area as well. Are you clear? If you guys are clear, you can type yes in the chat box so that we can move to the next slide. Or if you guys have any question, you can also post in the chat box. Good. Okay, guys. Okay, so this is one of the question. So a 14-year-old girl attends the GP surgery requesting the oral contraceptive pill. She is sexually active with her boyfriend. At her school, her parents are unaware of the appointment and she requests for the OCPs. What is the most appropriate management? So here, what will be the most appropriate management? So it is regarding the ethics section from the PLAB one. So we are going to discuss this in further details when we are going to do the further questions. So this is one of the questions that you will be seeing in your exam as well. So this is just a random practice question. Again, a 22-year-old man has a painful right eye for one day. He had similar symptom 1 year ago. He has an episodic back pain and stiffness, which is relieved by exercise and ibuprofen. His right eye is red and his vision is blurred. What will be the cause of the red eye? So as we discussed this scenario in a clincher, that it is ankylosing spondylitis and it will lead to uveitis. So sometimes the scenario can come like this way. So this is just another example of the question. You are going to get such kind of questions. Again, you guys can read by yourself, and this is a question from ethics. So this is just a random question, this is not an exam question. So we are showing you this because for the sake of understanding. So this is again a different question from the PLAB. So it says it is a question based on the autism spectrum disorder. So you can read the stem and then you can see why it is autism spectrum disorder. So this is just for an understanding, guys. Okay, no problem. We will share these questions in our WhatsApp group as well. Don't worry. It is just for an orientation. And if you guys have any question up till now regarding PLAB booking, study material, what you need to study, how to study, you can ask me. I'm going to answer that. So someone asked me during the session, what is the passing mark? So this slide is important. So the passing marks lies every year between 116 to 125. It is round about 60%, right? And the average marks are 120 to 130. So if you lie somewhere between 116 to 1125, so you are going to pass the exam. So every year the average changes. For February, the average changes. For my session, it's different. For August and for November, it's different. So usually it's from 116 to 125. So if you lie between any of the number between 116 to 125, so you are going to pass the exam and you will consider as pass. And you are going to receive your result on your GMC account. Yes, this exam is quite easier than MRCP. So if you have any question, you can post. I will be answering. Okay, so this one is really important. So what is this? Anyone can guess what is this in the chat box? We are going to share our schedule in the group. From there, you can understand that how you are going to divide the particular unit on particular days. Don't worry. Yes, this is answer sheet. So, for example, this is there. You will be having your name already printed, your name, your city, or this city will be the center of your exam, and your date of the exam. Then there will be your unique GMC number. This will be already printed on your sheet, and you will be getting this sheet with your own name, number, and your exam center and date. Then you are going to use the lead pencil. Now see my arrow. A, B, C, D, and E. For example, I am going to answer the question number one, and my answer is A. I'm going to fill this way. I'm moving the arrow. You have to fill the block like this. For second, you have to, for example, my answer is D. I'm going to fill the D. For C, my answer is E. I'm going to fill the E. Likewise, you have to fill from 1 to 180. And someone was asking that if we can change the answer. Yes, you can change the answer because it is later on recognized by the computer, and you are going to get your results, right? So you can change your answer anytime, but it is not usually recommended because you have only 1 minute for one question. So you are already lacking time. So just read the scenario, understand it completely, fill the answer, and move on. Yes, you need study material subscription for study. Yes, definitely, yes. And if you want to, and if you guys want to save this answer sheet, you can, because in exam you are going to get the similar sheet as I'm showing the picture here. And if you have any question, you can ask me. If you guys have any question, you can type in the chat box. Okay, so how to study smart? As we already discussed that you have to select one particular topic or one particular unit. You have to understand or read from the PLAB keys or Med Institute comprehensive notes. You can select any of these. Those PLAB keys will look like this. This is just an example. So this will be your PLAB 1 keys. It will look like this. For example, this is an acute limb ischemia example. So you have to read all the details in this PLAB keys. First of all, you are going to use this material for your basic concept. So these are known as PLAB keys, PLAB 1 keys, or we do have Med Institute comprehensive notes. You can use any of them as your base or as your tool to build the concepts. After this, you are going to have the question bank and you are going to study from that particular question bank. So as we already mentioned in the previous slides that we do have a question bank, Med Institute question banks with comprehensive recalls, keys and everything. And there are further two more available. One is Plabable and one is Metrovian. So how does the study group will help you? This is a picture from our own study group. So here we posted a question and you guys have answered the question. So by this way, we can have daily discussion in the group. You are going to answer, and if there is something important come up, you can take out the notes, you can note it down on your copy or notes. So by this way, it is really useful near the exam as well, because you are going to get the massive explanations and massive MCQs supply every time, so it is really beneficial. So now see, what is this? This is our question bank what we are offering. I am sorry, I don't know about the cost, but I'm going to take your question to my team and they're going to answer you. So team, kindly please note this question, that how much they cost. So they will post in the group and let you know. So this is the question bank. On this side, you can see the number of units and the names of units. And this is the question. For example, you are going to fill the question, pick the right answer, read the explanation, and then you have to move to the next question. You have to follow the like this, as we already discussed. This point is really important, guys, which is highlighted. Read the explanation very well, because this is all where your preparation will lie. If you are not going to read the explanation very carefully, you are going to waste your course material. So reading explanation is very, very important in PLAB 1 preparation. Just focus on reading the right preparation and with the full focus. This is too important. And if you have any question, you can post. Yes, they are similar, but pass med is for MRCP, but they are not pass med. They are different question banks. They are on the PLAB 1 level. Pass med is on the MRCP 1 level. So you don't need MRCP 1 question bank for PLAB 1 preparation, right? And in PLAB 1, there are a variety of units. As we already discussed, you are going to get questions from ops and gynae, from pediatrics, from ethics, from ENT. All of this is not being written in the past medicine, right? So past medicine is only for the clinical few subjects. So for PLAB 1, you need to have a different set of questions. I hope you are clear with the answer. So this is again important. After you understand your topic, you have read the explanation, you have filled in the question banks, you have given the right answer. No matter if it's wrong, then don't worry, you are read the explanation. Then you have to make your own good notes. Why these notes are important? Because these notes will give you a proper revision by the end of your preparation time. Now you can solve exam questions or updated questions, on our question bank as well. And you can discuss with me or in the group. So we are available every time. So anytime if you need help, you can post your query over there regarding your study. So we are going to help you. So this is again a slide from our, you know, study group. So it looks like this. And if you have any question up till now, kindly post so that I can answer. So, yes, we are going to take the question. Which question, please? We already discussed that in the question session. So don't worry, I'm going to take this question and we are going to discuss this again in our, our study group. So just don't worry. Kindly No problem. We are discussing already there, so just don't worry. It was just a picture from our group study. So what we will be your preparation sequence, set a 3 to 6 month study goal. We already discussed this in initial slides. Establish daily study targets. For example, you have to do, suppose there are 300 MCQs in gastroenterology. What you need to do, you need to establish a study target. You can select 70 per day, or you can select 100 per day, or you can select 50 per day with explanation. So it should be quality study. You can join study group. Anyone can join study group. You are welcome to join study group, Rafia Waheed. Then you assign specific days to each topic based on priority and exam relevance. Then you can study one topic independently using PLAB 1 keys or emergency tutor notes. Then discuss the topic in the study group with mentor to clarify your doubts. Then practice unit specific MCQs from PLABable or emergency tutor resources. Review and discuss MCQs with group discussion. Then revise the topic independently after group discussion. Join our live sessions or clinches with me. We are going to have a detailed Zoom session on clinchers or key points by the end of every unit. And then you are going to practice your exam questions. By this way, you are going to prepare yourself for the exam. This is the study sequence you need to follow for PLAB. Yes, we can. We will post. Don't worry. If anyone has any question, you can post in the chat box. We are going to answer regarding PLAB 1, preparation, study period, or anything. So someone asked me when reservation for the exam begins. So you have to follow the GMC official website. They are going to release seats from time to time. So you need to check with them, and you need to pass your OET. You need to create your GMC account. You need to upload it there, and then you are able to see or book the exam seat. So that's how it works. And if you guys are clear up till now, you can post clear or yes in the chat box. What kind of portfolio you are asking about? Can you elaborate your question more, please? Okay, so this is the last slide which will help students in the premium group. There will be live interactive sessions. There will be structured study plan. There will be best study resources. High yield points will be discussed. Unit-wise study approach will be discussed. Quick win strategies will be given. There will be clinchers for quick recalls, daily MCQs practice in premium group. There will be 24/7 mentorship. There will be updated keys, updated version. There will be Yankee style repetition cards. There will be mock exam and GMC oriented practice. So you are going to get everything in a premium group. If you guys join, you can join that group, and we are going to have all of this activity over there in coming months for my preparation. I noted your question, how many maximum day we can assign to priority topics. Ibrahim, I would suggest you to stay in our WhatsApp group. There, our team is going to post the schedule. We have planned it just today. So just follow with that. We are going to release that schedule in few minutes. Just follow that. You will get the idea how for how many days you have to follow the units. Don't worry. Right now, we don't have any um, such group with audits and research, but we will consider that doing. Yes, you can build your portfolio in your home country. That is very, very important as well, and that will lead you to have a job in future in England. Very important. Yes, you can. Any more question, guys? If you have any question, you can post. Otherwise, we are almost done. Job competition is always there, no matter which country you are choosing. So you have to work hard on your CV. By this way, you will get job. So just work hard. And if anyone needs study schedule, so they are going to post your name in the group. So we are going to share our study schedule there. All right, we will consider that doing too. Price for premium group. This will be, kindly post this in the group. Our team will contact with you. Um, you are going to get the price them from there. Any more question? And how many of you have already booked your exam? If so, then you can tell us in the chat box as well. All right. All right. So, guys, we are done with